Here we are, ladies and gentlemen, with a bit of sweet sleep. I don't know whether I wanted more of it or not, but finally we are here because that's what we do. But today, where you mentioned that it's 12th of February, it's a very important day because, ladies and gentlemen, today we're going to talk about an illness or a disease. We still have to kind of classify whether how do we refer to it? Whether it's acquired, whether it's by birth or not, because on 12th of February, ladies and gentlemen, it happens to be the International Day for Epilepsy, which happens to be the second, actually, Monday of the month February. But while we're at it, Ajay, there are a couple of things which I wrote down for people who are out there. So it's because of the annual raising initiatives that International Bureau of Epilepsy and International League Against Epilepsy come together, and they have two demands. So what they want to do is that World Health Organization came up with a 10-year plan, the intersectoral global agenda on what we really global action plan. So what they said was that by year 2031, there should be more coverage for people who are living with epilepsy, more than 80%. And next they said that there needs to be more legislation for it. We will talk about it, the legislation part of it. But since we have the medical experts over here, so we really need to know about this illness. There's a lot of stigma attached, whether women who've got epilepsy, should they get married or not, whether they should get pregnant or not, whether a person with epilepsy can drive or not. So with all of these questions, whether it's treatable or not, ladies and gentlemen, we're very lucky that we've been joined by a wonderful guest over here, all the way from Maroof International Hospital. Happens to be a specialist epilepsy and neuromuscular disorders. He is Dr. Yasir Mehmood. Malik, hello sir, assalamu alaikum, good morning. How are you doing today?
Well, thank you so much. Thanks for the nice intro, and I'm doing well.
Thank you so much,
Dr. Saab, let's start with this particular, is it a condition like Shahzad mentioned, or is it a disease? Explain us about it and whether it can be acquired or it is by birth. So what is epilepsy?
Thank you. It is in fact a disease. Rather, I would call it a syndrome. Syndrome is a complex word. When the disease goes into the complexity, we call it syndrome. Why is that? Because epilepsy, along with it, contains a lot of stress, a lot of social stigmas, a lot of suffering for not only the patient, whole the family, with a lot of complications related to epilepsy itself and related to its medications. So I would call it a syndrome. But stigma about epilepsy, we should treat the patient. We should not be scared from the patients. We should not be scared from the disease itself. We should not make it a social stigma. It's a treatable thing. They should live a normal life. We should treat the patient as a normal human being, and not something abnormal or not something which we should keep away and not to touch.
If someone is diagnosed with the epilepsy, or in other words, I think in a layman term we call it fits, right? So how to approach that person with a more sensitive approach that is or inclusive and guarantees the basic human rights to that particular person who is undergoing through this syndrome or disease or whatever you call that?
Okay, I would. There are two approaches. First, I would tell you about the social general approach with the general population. What they should do?
Okay.
So, if you see a patient seizing, I mean, patient is having a fit. You should always put the patient down on the earth, or put the patient on the bed in a left lateral position. I mean, turn the patient to one side. Give open airway. I mean, don't crowd around the patient. If there is a fan, you should run the fan. If not, it's not too much cold.
So there needs to be more air to not suffocate him.
Exactly. He should not be suffocating. There should be good oxygenation of the brain. Secondly, if the patient vomits out, that should go down. So you should have put the head in down lateral position. If you are comfortable, you can put some plastic spoon into the denture of the patient so that the air should not go back and occlude the airway of the patient. So the tongue should be forward and it should be compressed down. You should be open the denture. Don't try to put your finger, that can be damaged. And the second approach is to immediately take to the doctor what the doctor should do. For the first seizure, usually we don't treat the patient. I mean, we should give an abortive therapy at the moment so that the seizure should go away. We should work up, we should do certain investigations to look what is the cause of the seizures. Sometimes these are the provoked seizures, sometimes these are unprovoked seizures, sometimes there is underlying pathology in the blood or in the brain. We should look for that. If there is existing pathology, then we should treat for the long term. If not, then we should just do some precautions and wait for the second.
So let's classify in between provoked and unprovoked as well, so for that, because our sole purpose is to raise awareness. So first of all, let's get going with the provoked ones.
Provoked seizures we detect based on the history and some investigations. We should make sure patient slept well last night or not.
Okay.
Did patient take any new medicine? Because there are certain medicines who can increase the risk of seizures. Did patient have any fever or infection recently or these days?
Right.
And in the blood, is there low sodium level, low glucose level, low magnesium level? These things. And if on CT scan, if there is some hemorrhage or some stroke or some infection in the brain. So these all are causes of the provoked seizures.
Okay. And when we
If
talk
these
about
are not there, if the means
There's
on
no
the
reason.
history there is no fever, slept well, there is no new medicines, patient is quite healthy, there was a seizure by chance, and we do all the blood investigations and the brain investigation, that these all are negative. So that means it was unprovoked seizures. Unprovoked seizures, sometimes we can wait for the next one. We just reassure the patient, tell them to take certain precautions and then send the patient home. They should feel relaxed and they should feel normal. Just observe certain precautions.
All right.
And
What
if
are
there is
those precautions?
Precautions are like you should sleep well, at least for the young 7 to 8 hours a day.
Okay.
For the elderly 6 to 7 hours a day.
Okay.
You should be physically relaxed and mentally relaxed. Medicines, whenever you're taking new medicine, suppose if you're having a cold, common cold or flu, you're going to the doctor close by, you should tell the doctor that I had a seizure previously.
Okay.
So that doctor should take care of this thing, and doctor should not prescribe that medicine, which can lead you to another seizure. So these are precautions.
And sir, now when
And
we
infections also,
so
to be prevented.
obviously, and when, because we are talking about provoked seizures as well, so we've spoken about how infections can certainly be a reason, and there can be other multiple reasons for you to get seizures. Now imagine that that this is something that we are talking about daytime, when there are people around you. God forbid, if you're ill, if you're going through or you're suffering through any illness, you were sleeping, can you get a seizure during your sleep as well? And what do you think a patient can do while they're having seizures? When
Yeah,
they're
If no one is around, right?
Yeah, there are certain epilepsies which happens exclusively at night.
Okay.
So you can have a seizure, obviously. So first of all, we tell the family to, if there is first seizure, of course they would not know anything. I would still say they should put the patient in left lateral position or maybe right lateral, any of them is fine. And aeration should be good, ventilation should be good, and there should be vomiters outside, or try to open the denture with a plastic flexible spoon. That's all. For the second, suppose first year has happened. For the next year, we tell the patient to be careful, make the patient calm, relax, should be having good sleep at night. There should not be hard objects around the bed. Suppose if he's having a seizure, he can bang his arm or leg with the railings or or wall or anywhere alongside the bed.
Right.
And I always tell my patients, because everybody is carrying a video camera these days in the mobile, so I always tell my patients to record a video. It would be very easy for me to identify whether it's a true seizure or not.
Okay.
So the treatment would be based on that video.
So what do we mean by a true seizure? So that people can classify it as well.
Yeah, that's very good. Because many of the times, especially in the youngs, we see fake seizures, pseudo seizures. If they have seen some videos on YouTube, or if some of the family members having epilepsy, or if they have heard about the seizure, they would pretend like seizure for some secondary gain. Actually, there is no seizure, they would pretend like that.
Okay.
So we have to differentiate that. That is called pseudo seizure, or in the common term, you can say fake seizure.
Right.
We have to differentiate between the true seizure, and because see, if there is a patient with epilepsy, I'm going to start a medicine for epilepsy on that patient.
Sure.
And that would continue maybe lifelong or maybe many years.
Right.
And if the patient is actually not having seizure and I'm starting that medicine, it's unfair with the patient, right?
So can't there be any test, with which we can actually check whether the person is epileptic or not? Any run-ups, anything that with which the doctors can actually
during
see?
seizures, you should look how are the eyes. Most of the time in a true seizure, eyes are open. They are either uprolled or deviated to the right or left, or they are open. So you should check whether the eyes are closed or not. If the eyes are closed, you should try to open the eyes. If the patient is forcefully closing the eyes, not letting you open the eyes, it means patient is pretending.
Yeah, so
secondary gain.
So that means that you can identify it just by looking at the condition. So there is no other test like that. But Dr. Saab, now let's discuss the role of diet in that, particularly when a person is going through an epilepsy. And what sort of a diet would you recommend that would make him
You will be surprised with my answer,
Right.
because this is the only disease where high cholesterol diet is favorable.
Okay.
So the patients with epilepsy, but usually initially we don't tell to the patient that
Okay.
take high cholesterol. If the medicines have failed, then we tell them that go on ketogenic diet. Ketogenic means the diet that contains high cholesterol, like beef, like butter, cheese, cream, these things. So they would favor the control of epilepsy.
So, but then unfortunately,
Well, you have to control the weight
there
also.
can be other pathological disorders. then.
Exactly. You have to take the things are like that, you have to manage all the things.
And then you have to exercise as well. You know, would you recommend exercise for person who's epileptic? You know,
Yeah.
probably not lifting weights, but you know, going out
Exactly.
for a walk or swimming. or
General
something.
exercise for the walking, for the
Right.
jogging, at least 15 to 20 minutes or maybe half an hour a day, it's acceptable for that,
Yeah.
provided they're not getting a lot of tiredness.
And I think walking and jogging is recommended because of the fact, unfortunately, if you're swimming and you get a fit, that's going to be a difficult
Yeah,
situation.
no, there is another thing I certainly need to tell you, that we ask all the patients of epilepsy not to swim or not to swim alone.
Okay.
There should be a person standing by who can swim, who can rescue you during a seizure.
True.
Suppose if he's having uncontrolled seizures and he seizes during the swimming,
True, that's
there can be a life-threatening situation. So there should be a rescue person alongside that. Number one. Number two, working for the epileptic patients, driving, working at heights, working near fire, working near heavy machinery or sharp objects. These are totally not recommended.
Okay.
And let's, Dr. Saab, also discuss, because we have the paucity of the time, the social stigma, the taboo surrounding this disease, right? So if you have patients who are epileptic, what do you recommend to them? And especially, I think doctor is also a healer, so he's also counseling at the same time. So what sort of recommendation or advices you dole out to their family members in order to, so that they should be more sensitive to someone who is an
Exactly.
epileptic patient?
We should always take the epileptic patient as a normal person.
Okay.
He is allowed to live a normal life like
Okay.
me and you are living.
True.
For the young ladies, they should be marrying normally. They should be going through pregnancy and lactation normally. They should be sticking to the medicine, not missing the medicines, and always observing the precautions to prevent a seizure. Otherwise, they should live a normal life. Their profession should be modified in a way that they should not be, as I told before, should not be driving, should not be working close to height, close to fires, heavy machinery, sharp objects, or
Right.
at heights. Profession wise, they should be modified, otherwise they should be living a normal life.
Exactly. But sir, in addition to this, there are multiple questions which we need to ask, and that is that, for example, if we are talking about a lady who is going to get married, she was epileptic, you said that it's absolutely fine for her to do that and to get pregnant as well. Do you think that this illness is actually inherit? You can inherit such a disease because of your genes as well. Number one. Number two, God forbid, if the mother is getting seizures while she is pregnant, do you think that there is going to be an impact on the baby as well? Not by a fall or something, but just by having a seizure.
Yeah, it's a very good question. In fact, it's a wonderful question. See, there are two types of epilepsies. One is genetic, that is inherited, and second is acquired during the life. So inherited ones are genetic syndromes. They exist and they are in the families from one to other, and certainly they can be there in the from mother to the fetus, children also. For that, usually we tell, if there is a syndrome in the family running and we know 2 or 3 people who are having that, we recommend the people to not get married within the family. It should be outside the family. That is better. Number one. Number two would be whether there is impact, your question number 2, whether it would be impact of the seizure on the baby or not. There is certainly an impact. When the mother is seizing, during that, mother doesn't get enough blood to the brain, to the womb, and there would be no sufficient blood supply to the fetus. There can be reduced, or there can be breakage of the arteries supplying blood to the fetus. So the fetus can have reduced growth intrauterine, or fetus can have reduced mental activity later on after the birth.
Okay, and this is one thing that we are discussing from the perspective of the mother, gets a seizure and whether there's going to be an impact on the baby or not. But imagine that a person who's already epileptic, do you think that it's very advisable for them to get pregnant? Because otherwise it can be harmful for the mother too then.
Yeah, see, despite of this disease, they have to live a normal life.
True.
They have to get pregnant. We cannot say them not to get pregnant.
Obviously.
But there are certain precautions they should observe before that. What are these? Like they should visit their doctor before getting pregnant.
All right.
They should tell the doctor that, doctor, I am planning for a baby.
Yep.
So doctors should modify their medicine. There are certain medicines who are safe during pregnancy and certain medicines who are not. The doctor should switch the medicine to the one that is safer in pregnancy. And during pregnancy, as the weight is gaining, as the baby, mother is gaining the baby, the water in the tummy.
Yep.
So there is the level of the medicine which was there before, which was effective for the mother. Now it's not effective anymore because weight is more. There is dilution of the drug.
True.
So we have to increase the dose of that medicine.
True.
So
it's
that
just
should
like,
be managed
for
by the
example, how I weigh probably 90 kgs, so the doctor will always ask me, okay, how much do you weigh? Then he is going to give me an antibiotic, okay, yaar, take 1 mg, twice a day, so it totally depends on that. And that's understandable.
Exactly.
But in addition to this, Dr. Saab, now we live in a country where we have a lot of stigmas. Now imagine that, we grew up where we never knew that, okay, fits was something or epilepsy is something. Imagine that there were times when people would say, isko chappal sunga do. Isko pyaz sunga do, things like that. And we have grown up with these things. So can you please list a few what people might do which is literally stupid to do to a person who's getting epileptic fits?
Acha, I have worked most of the time in Islamabad. Before I was working in Lahore also. Islamabad people are very much educated, or they are close to educated people, so they are not doing these blunders anymore.
Thank you. Yeah.
Right.
Myths are gone now, but still in the past they used to do that. Social stigmas and these things.
Peer Baba de Gol
Peer Baba, they would not consider that it's epilepsy sometimes. This happens here.
Okay.
They would say this is jinn only.
Right.
Yeah,
Many of the people who are under treatment, still they would say, doctor, what do you suggest? Should we visit a Peer Baba also? Maybe there's a jinn here. So these are the
what do you
problems
say then?
To these people, I say, okay, you can go, because I cannot breach their religious concepts. So I would say, okay, you take there, but you don't miss my medicine, please.
Okay. Yeah.
Continue both things together, it will work.
I think it's always a mix of both as well and a combination. But it's a humble request. Obviously, we're not denying that this cannot happen. You see, this is something. Yes, sir, please.
Sorry. Our people are very much religious. You cannot breach these concepts.
Yep.
So you cannot change their concepts also. So better you modify your saying in the way that they.
But sir, obviously, I mean the Western medicine, because the one that you have been studying and the one that there is a lot of research going on, it usually deals with the symptoms, right? And it tries to deal with the symptoms and then try to find a solution. But there are certain diseases that are diseases of soul, and then they manifest in your body, right? So as a doctor and as someone who's a practicing Muslim, how do you recommend, integrating both of these approaches, the Western medicine approach and also the Islamic approach? Because there is a hadith that except for the death, every disease has a solution, every disease has a cure out there, right? So how do you approach or tell those people, especially who have a strong religious beliefs, because obviously...
And what we really need to kind of highlight over here is it's the soul's manifestation of getting you to that point where you're getting ill.
Right.
So it's not more of a biological thing, but more of a...
Exactly.
Because your body is very intelligent. If you're undergoing through some, very important thing, the body is always telling you, it is always signaling you that there's something wrong in that, right?
Body is your thermometer then.
Yes, you need to listen to your body, and body will give you answers out there.
See, most of the psychiatric illnesses, these are related to the soul.
Right.
And these are most of the time healed with these religious healers or counseling, or these psychologists also doing counseling only, therapies. So such diseases mainly psychiatrists are dealing, but still sometimes patients who are coming to me, they're having blend of the diseases. They're having psychiatric illness also, and epilepsy or the other diseases also.
True. Because you mentioned psychological stress as a one of the
So for those, definitely alongside the medicine, I would do the counseling. And for the religious, your question, first half of your question, for the religious, of course, I would not breach their concepts, religious concepts. I cannot change their concepts.
Right.
So I would modify my ideology like that. Please don't miss my medicine. And you can make dua, you can take him to the PE, there is no problem. So they would do that. They would listen that. So and I would counsel religious point of also.
So, but then there's going to be two more questions, sir, and it's because of the fact that certainly people who are actually living with people who are epileptic, I think it's for their awareness as well. Number one, because you've worked abroad as well. You were in UAE for 10 years. You were in Lahore. Now you're in Islamabad. 2021 you joined Maroof International Hospital, coming from Dubai as well. So with different regions and geography, there will certainly be different problems. Did you ever come across a person or a patient who was getting fits but wasn't epileptic, you know, it was something else. Did you ever come across that? You know, so many. So that we
of them.
actually support our narrative that, okay, there can be issues with your soul as well, and how, you know, Allah actually keeps on telling us that, you know, if you remember me, you know, I'll give you the peace of heart.
In fact, if we go to the research studies, 30% of the people who are having true epilepsy, they are having blend of 30% of them are having blend of true plus fake seizures.
Okay.
And 30% of who are being treated by the psychiatrists, who are having only psychiatric illnesses, they are also having 30% of them are also having true seizures.
Okay.
So we need to be very much particular about
Careful,
picking
yeah.
these things, taking history, giving time to the patients, then investigating and listening to each and everything mildly. In fact, in my mobile still few videos exist. I tell the patients to make a video and send me. I could show you, but of course I don't have.
अम्मी पूरी झूठ बोलते हैं, पकड़ लिया आपने, चुप करके फिट डाल दिया,
many
आपने तो
fits, many
मसला बन
fits,
गया.
fake fits.
Right.
And we have to pick them by video, and we have to. It's difficult to assure the family that it's not a true seizure.
Yeah.
Family is not listening there. No, doctor, we cannot live without this treatment. How can we leave the patient? I would tell, okay, you give, these are attention gaining skills. You give less attention to such
He's going to be fine. Or she's
such
gonna be fine.
particular dramas or whatever you say. Please don't give attention. Patient would be better. No, doctor, how can we leave that?
Exactly, because as a parent you certainly cannot do that. Na? You know, you cannot bring your heart to a conclusion that, okay, you know, my kid is actually doing it that way. You know, you will never accept that. But one last thing, sir, is there any way that any parent out there can figure it out from, you know, at a very early stage whether my child is epileptic or not, even when they haven't had a fit at all? Do you think that there are ways that people can pick up that, God forbid, this might be a problem?
Not really.
Okay.
But if there is delays in walking and talking, like their developmental milestones are delayed,
Yep.
that can sometimes lead to epilepsy.
Okay.
So these are the things, if there is concern, such concern of the parents, they should bring to the doctor.
Okay. Wonderful.
Right.
Thank you so much,
Thank you
Dr.
so
for
much.
being with us. Lovely to
Thank
be
you
in
so much.
conversation with you.